Okay, cephalic vein, that is a large vein in the arm that empties into the axillary vein, also known as the antecubital vein. Circulatory system, you want to highlight circulatory system. That's the system that moves blood through the body. All right, coagulate. You want to highlight coagulate. The process when blood turns to a solid or semi-solid state, creating a clot. All right, next one is collateral circulation, an alternate path for blood developed through enlargement of secondary vessels after the main path is blocked. So you don't have to highlight that one, but just be familiar with that term, collateral circulation. Complete blood count. Now you want to highlight that one. That's one of those tests that you should know. It's a blood test performed to evaluate your overall health and detect certain diseases. Complete blood count. So in addition to knowing that definition, you'll want to know some of the tests that are inside that complete blood count. And those should be in your notes. All right, the red blood cell, white blood cell, platelets. Contact precautions. Guidelines recommended by the CDC for reducing the risk of transmission of epidemiologically important microorganisms by direct skin-to-skin or indirect contact. Contact precautions. Contagious, the ability to be spread from human to human. Contamination, unwanted pollution of a substance by another substance. Contusion, you want to highlight contusion. That is a bruise in the skin where blood capillaries have been ruptured. Cytoplasm, the liquid inside the cell membrane. Defibrinated blood, blood that has been deprived of fibrin. Dialysis, the process of removing waste from the blood because the kidneys aren't able to. So you'll want to highlight dialysis. Dialysis technician is also another job that you could do as a phlebotomist. You could be the phlebotomist that hooks the person up to the dialysis machine so that the machine can remove the waste from the body, from the blood. So the dialysis machine cleans the person's blood and then returns it back to them. Differential, a blood cell count that assesses the ratio of white blood cells. Now, differential is part of what test?
The CBC.
Yes, good job. Yep, that's part of the CBC. So highlight differential. You don't want to forget that one. It's a blood cell count that assesses the ratio of white blood cells. Ecchymosis, you want to highlight this one. That is the discoloration of the skin where a contusion occurs. Ecchymosis. Next one is edema. You want to highlight this one. You don't want to forget that one. That's the swelling caused by excess fluid accumulation in tissue. You never want to do a venipuncture or a capillary puncture on a part of the body that has edema. Next one is embolus. That's the mass of clotted blood that obstructs a blood vessel. Next one is EMLA cream. And EMLA stands for eutectic mixture of local anesthetics. That's a cream mixture of lidocaine and lidocaine that is often used locally on children for blood draws.
Hmm.
So that's a cream that they'll put maybe on in the anacubical fossa area to numb the area, or they'll put it on the hand if they're going to draw the blood from the hand, just to
Oh,
so that it'll be less painful, or maybe not painful at all for the child, so that they don't feel it. Yeah. Endothelium, that's the layer of cells lining the cavities of the heart and of the blood and lymph vessels. Endothelium. Epidermis, that's the outermost layer of the skin. Epithelium, the layer of cells covering the free and open surfaces of the body, including the skin and mucous membranes. Erythrocyte, you want to highlight erythrocyte. That's the term for a red blood cell. Factor VIII, that's a factor in the clotting of blood. You want to highlight that. Factor VIII, it's a factor in the clotting of blood. It's also known as the anti-hemophilic factor. When we went through the A's, we saw that one. All right, fasting. You want to highlight fasting. I think we already know what that means. It means not to eat. It's common before a phlebotomy procedure is performed. Fibrin, it's a protein that is necessary for blood to clot. It's created by the action of fibrinogen and thrombin. So you don't have to highlight that one, but be familiar with it. Basically know that it's a protein that is necessary for blood to clot. All right, next one is fistula. You want to highlight this one. It is an abnormal connection from a vein to an artery to change the flow of blood. When a person is on dialysis, meaning they take dialysis, they get their blood clean. This is what is going to be used to connect them to the machine.
okay.
Fistula. It's an abnormal connection from a vein to an artery to change the flow of blood. And we'll talk more about that when we get to the blood drawing and the venipuncture part of the class. But right now, just highlight it and know that it's an abnormal connection from a vein to an artery to change the flow of blood. All right, next one is gauge. You want to highlight this one. Gauge is a measurement used for the diameter of a needle. The larger the needle diameter, the smaller the gauge. Glucose. You want to highlight glucose. That's the sugar in blood that our body makes from food. Hematocrit. The proportion of the total red blood cells to the total blood volume. Hematoma, you will want to highlight hematoma. That's tissue that is filled with blood caused by a break in the wall of a blood vessel. It's also commonly known as a bruise. You definitely want to highlight that one. You'll be seeing that again, hematoma. Next one is hemoconcentration. You want to highlight this one. Last week we talked about the pumping of the fist before venipuncture. This is why the person will not pump their fist, because of this. Hemoconcentration. It decreases the volume of plasma in blood compared to the number of red blood cells. Dialysis, procedure to remove waste products from blood and to restore an electrolyte imbalance. Hemoglobin, you want to highlight hemoglobin, the oxygen carrying protein of red blood cells. You'll be seeing hemoglobin again. And you want to know that it carries the oxygen in the red blood cells. Hemolysis, you want to highlight hemolysis. The freeing of hemoglobin from within the red blood cells into the blood plasma. In your notes last week, you wrote that hemolysis is the destruction of red blood cells, right?
Mm-hmm.
This definition is a fancier way of saying it.
Okay.
Hemostasis, to stop bleeding by vasoconstriction and coagulation or by a surgical process. Hemostasis is basically the balance, the steady state. So you want to highlight that. So we're going to talk about that more also. Heparin is a complex organic acid that is found in lung and liver tissue that prevents blood clotting. Hepatitis is inflammation of the liver. Hepatitis A, inflammation of the liver caused by hepatitis A virus. Hepatitis B, an infection of the liver caused by hepatitis B virus. Hepatitis C, an infection caused by hepatitis virus that attacks the liver, leading to inflammation. Hyperglycemia, an abnormally high blood sugar level. Hypodermic needle, a hollow needle that attaches to a medical syringe to inject or withdraw fluids from the body. Hypoglycemia is abnormally low blood sugar level. Lymph is a clear fluid found in the lymphatic vessels that is collected from body tissue and returned to the blood. Lymphedema, a type of tissue swelling and fluid retention that occurs in lymphatic tissue caused by a compromised lymphatic system. Medial cubital vein, you want to highlight this one. The forearm vein most commonly used for venipuncture because it is generally the largest and best anchored vein. So you would definitely want to highlight medial cubital vein because this is the vein that you will most often be trying to find when you're doing your venipunctures. That's the most commonly used vein for venipuncture, the medial cubital vein. Monocyte is a white blood cell that has a single nucleus and very fine granulation in the cytoplasm. It makes up 3 to 8% of white blood cells in humans. Nosocomial infection, you want to highlight that because you don't want to forget that one. You'll be seeing that again. It's a hospital-acquired infection, an infection that you acquired from the hospital or healthcare facility. Order of draw, you want to highlight that one. You already know you're going to be seeing that one again. That's the order, the order in which blood samples should be drawn to minimize interference, contamination in testing caused by carryover of additives in tubes. Did you get a chance to review the order of draw this weekend? Okay, good, good, good.
Yeah, actually, I was online and there's like a bunch of different
Yeah,
like ways. Like the one was boys love ravishing girls or something like that.
yeah,
Yeah.
yeah. There's a
And I
lot.
actually bought these little cards. They're like these little, and I think these are gonna help me a lot. But they're these little cards.
Oh yeah, for the order
Uh,
of draw.
huh?
For the order of draw.
Yeah, it has like the order of draw, but also it has like what it's used for, the common tests.
Okay, good.
that you-
Yes, that will help you a lot. They
Yeah.
they look like badge size. They look like they'll fit on your badge too.
Yeah, that's what they are. They're mini. It's got other ones though. It's got like temperature and the EKG placements and a bunch of different little ones.
Okay, good. Yeah, that's good.
Yeah.
Palpate. You want to highlight palpate. Palpate is to feel by hand. For example, to find the size and direction of the vein. So you want to highlight that one because that is one of the things you'll be doing that's going to help you find veins. Palpate. Pathogen, an agent or microorganism that causes disease. Peripheral blood, that is blood that is obtained from the outer surface of the body. Phlebitis, a condition resulting in inflammation of a vein. Phlebotomist, that is one who specializes in phlebotomy. Phlebotomy is the practice of opening a vein for drawing or letting blood as a therapeutic or diagnostic procedure. Plasma, you want to highlight plasma. That's the fluid or liquid portion of the blood. And we'll talk more about plasma when we talk about the components of blood. Platelet, you want to highlight platelet. That's a disc-shaped element found in blood that aids in clotting. Platelet pheresis is the process where platelets are removed from blood with the remaining elements being returned to the donor. Polymorphonuclear, a white blood cell with a nucleus that is so divided it looks like it is more than. Povidone iodine is a solution of polyvinyl polynodine and iodine used as a topical antibacterial agent. Red blood cell. You want to highlight red blood cell, the blood cell that contains hemoglobin, which allows them to carry oxygen. Sclerosis, the hardening of a damaged vein wall. Serum, we want to highlight serum. That's the clear fluid that separates from blood when it clots. Syncope, you want to highlight syncope. That is feigning or a temporary loss of consciousness. So it's always important to ask the patient, have you ever fainted before you got your blood drawn or when you got your blood drawn? So that way you'll know to do what with them. Why is it important to ask the patient if they've ever fainted before?
So you know, like the right precautions to take if they're going to faint.
Yeah. And what would be one of the precautions you would take?
Like have them sit in like a reclining chair.
Yep.
Possibly like, I don't know if it's like sugar related, maybe have something like sugar wise or something like that.
You would draw their blood while they're reclining back or lying down.
Yeah.
Thrombocyte. You want to highlight thrombocyte. Thrombocyte is a platelet, and it is important for blood clotting. Thrombocytopenia, a condition that decreases the number of blood platelets. Thrombosis, the presence or formation of a blood clot, thrombus within a vessel. And then thrombus, you want to highlight thrombus. It's a blood clot in the wall of a blood vessel. So thrombus and thrombosis, they're the same. Thrombosis is the presence or formation of a blood clot within a vessel, and thrombus is a blood clot in the wall of the vessel. So it's basically the same. Tourniquet, you want to highlight tourniquet. That's the band wrapped tightly around the arm to stop the flow of blood to a distal part. Vascular, relating to or composed of blood vessels. Vasoconstriction, the narrowing of the blood vessels that results from contraction of the muscular walls of the vessels. Vein, you want to highlight vein. That's a tube in the body that carries blood to the heart. So remember that veins carry blood to the heart, toward the heart. Venisection, it's an incision of a vein for the purpose of collecting blood. And another word for venisection is phlebotomy. Venipuncture is the puncture of a vein. You can highlight that, but you don't necessarily have to, because I don't think you're going to forget venipuncture, right? Venous is relating to the veins. Venule is a small blood vessels that merge with veins. So venules are tiny veins. White blood cell, a colorless or white cell in blood that has a nucleus and cytoplasm. Highlight white blood cell. We're going to be talking more about that one later. Whole blood, you want to highlight. Whole blood is blood where none of the elements have been removed. And the elements are white blood cells, red blood cells, and platelets. It's the whole complete components of blood. Nothing has been removed. White blood cell count, the number of white blood cells found in the blood. So white blood cell, that's WBCs. And looks like that's the end. That's the end of the most commonly phlebotomy terminology. So you highlighted a lot, huh? If you went back and looked through them all, you will notice that a lot of the ones that you highlighted deal with clotting.
Mm-hmm.
Did you notice that?
Yeah.
A lot of, so those are some ones that you definitely have to know.
Okay.
Okay, so we've covered a lot so far. So let's take a break, and then when we come back, we'll go more into the medical terminology. So let's take 15 minutes and come back at let's come back at 11:45. So that's about 20 minutes.
Okay.
All right.